It started about a year before I got married, and it was a chance discovery of a problem, really. I was serving in Taraba State at the time, and one of the nights when I had to go to bed, I lay in bed and I just felt like there was something underneath my tummy because I was lying on my tummy. So I thought I had forgotten something in my bed that I was lying on top. So I turned over and I didn't find anything in my bed. So, of course, all my alarm bells went off. And the first thing that occurred to me is if there's nothing in my bed, then it must be right inside my tummy. So I turned over on my back and I started to feel my tummy, trying to see if there was actually something there. And true to talk, I could feel something on the inside. So at this point, my antennas went up. I became the doctor that I didn't want to be at the time, and very quickly I started running through a list of diagnoses in my head. And I think I was smart enough to remember that they had taught us that common things occur very commonly. So I thought, okay, the most likely thing it will be is fibroids.
I fell pregnant in my first year of marriage. Then I miscarried. So during the course of evacuation, after that, my menses ceased for like a year. So we're just running from pillar to post, health centers, government-owned hospitals, trying to find out why it was that way, but nobody could tell us what the problem was. So it went on like that until one day, I think I was just talking to a doctor friend, and he was like, "You could have scar. Did you have an evacuation?" I said, "Yes." Like, could be scarring in the uterus. I was like, "Oh, I've not heard that before." So I went to Google my symptoms and everything, and there it was there, uterus scarring. So I went to the hospital in Ikoyi. They confirmed it, that was it. I was shocked. How could all these doctors not get this all these years? I think it was about a year and 4 months by then, without period. So they now said I was supposed to have an operation, hysteroscopy. And as at that time, they didn't have the, appliances for it or apparatus or something. So they needed to get in a doctor from London to do it. So I had to wait for a month. So I was scheduled for that treatment. So when the doctor came, I had the hysteroscopy, and he said everything was fine. I had 70% scarring the uterus. So he said everything was fine, that my menses would start again after 3 months. So I had a coil in for 3 months. But when the coil was taken off, nothing still happened. And the next thing they said was like, "We don't know what happened. IVF, that's the solution now." And I was like, "IVF? Can't we just do all that tests and try to find out what the problem was?" They were like, "No, okay, let's just go to IVF." So I didn't want to continue with them again because I thought they didn't have enough information of what was going on with me. So I moved on.
I met my husband while we were supposed to be studying. We were at Imperial College London. We got married in May 2009, and I said to myself, without his knowledge too, that I was going to wait for about 3 months before we tried for a baby. And God was so merciful. I conceived in 3 months, really, after we started trying. In fact, I remember, because he works offshore, he went in Port Harcourt. He used to work, he used to go offshore, then he'll come back. So I remember that day he called me and said he was coming home, but he wasn't supposed to come home that weekend. And he came home, and before I went to pick him, I actually felt, those ovulation pains. And I was just joking and saying to myself that, okay, this man is in trouble. And he came home, and really the next month I was pregnant. I conceived, and that's how we had our son. And he was born in May, which is the same month we got married and also my birthday. After my son was born in 2010, I went on the copper coil because I thought that was safer. You know, I wasn't going to have to deal with any hormonal changes. And I took it out September 2012, and I conceived in November. So I prided myself as the fertile chick. I think I went to the hospital in November and no, I conceived in November, then I went to the hospital in December, and you know, they said, oh, you'll come back, just be on your folic acid, blah, blah, blah. Now, unlike my first pregnancy, this one was very different. For my son, I had no issues, I had no nausea, I didn't gain weight, I had no drama, and delivery was also very smooth. But for this pregnancy, for some reason, I was always hungry. As I'm eating, it was just like there was a big hole in my tummy. So as I'm eating, the food was just coming out. You know, I was always hungry. Then I started to suffer a bit of nausea towards the evenings. I just didn't feel myself, and I was always wondering. And you know, when you speak to people, people will say, "Oh, you're just experiencing pregnancy firsthand. You know, your first one was just you were lucky." So after sometime in January, I started having pains. Same people said, oh, sometimes you have these pains, you have cramps and all that. But there was one day it was, you know, really hurting, and I decided to go to the hospital. Went to the hospital, they did a scan, and, you know, there they said, oh, it looked like, you know, the pregnancy is threatened, so we would advise you to be on bed rest.
Infertility is the inability of a couple to achieve conception despite regular unprotected intercourse for up to 1 year. So if they've been attempting to achieve conception for up to 1 year and it is not happening, they should seek help. But we have some additions that we also talk about in terms of the age of the woman. If a woman is above 35 years old, they've been attempting to achieve conception for up to 3 months, 6 months is not happening, such couples will not wait for 1 year before they seek help. It's better they come early, the husband does semen analysis, the woman does HSG so that we look at the tubes, and then she can perform an ultrasound scan. We ask them some questions in terms of whether the woman is cycling, does she see her periods regularly, and other important questions. Then we'll be able to advise on what's next.
I was 31 when I got married, so I thought, okay, it's going to be quick. Marriage didn't come very quickly, so the kids will come quick. So I think for me, by my 3rd month of marriage, I had already started getting a bit worried. I started listening to my body. For some reason, I was beginning to put on an inexplicable amount of weight, not commensurate. My diet hadn't changed much. I know people say you're newly married and then, you know, you're bound to put on weight from the happiness factor, but it wasn't really commensurate with, you know, my diet. I was putting on a lot of weight, and the 1st month passed, 2nd month, 3rd month, no conception. People thought I was being silly for worrying so early, but I knew that I wanted to have it checked out because my body just wasn't feeling right. So my 4th month, I went to a hospital on my HMO. We were just a few months after the marriage. Pockets were still a bit lean, so I couldn't afford my regular doctor. So I had to go to the HMO. And it was a very impersonal place. I think I was there for about 3-4 hours waiting to see a doctor. And when I did see a doctor, it was some very unfriendly lady who more than poured me, and then there was an exam, and then I was asked to come back for a hysteroscopy, which was basically them, you know, checking out what's going on in my uterus. This was in April 2009. So I had the hysteroscopy. They said my uterus was fine, the tubes were okay, but one of them seemed to be, didn't flow quite as freely as the other one. So for me, it was a pretty decent diagnosis. I had started doing a lot of reading. I read about PCOS, and I asked them, but they told me, no, your hormones are fine, everything is fine, nothing is. But everything I read on the internet, I was basically ticking all the symptoms of PCOS, the weight gain, tick, my hair was thinning, tick, so many of the symptoms, you know, I was taking all of these, but the doctors were telling me, oh, no, your hormones are fine, your ovaries are not polycystic at all. So I stuck it out with this hospital for the rest of the year because I didn't have a choice. I couldn't afford to go back to my regular doctor. And in all this while, I never did see the medical director of the hospital, you know. It was always, and I never did see the same doctor twice. You see this doctor, you come back and there's another doctor, so there was no real follow-up or follow-through. But then I insisted I wanted to see the medical director, you know, because he was the name behind the hospital. He was the name behind the clinic. So I was booked in on a Saturday morning to see him. And it was the worst experience of my life. I felt like I'd been on a conveyor belt system. I don't think he even looked me in the eye once. He just read through my case notes, mumbled a bit and told me, all he told me was, come back with your husband. That was all he told me. So I mentioned it to my husband, and because my husband he did not understand why we had been married less than a year, why was I fussing? So we went on vacation because he thought that would basically make me calm down. We went on vacation, we came back. And then after coming back from vacation, one of our former neighbors then told me how, she also had a delay. But then she met a lady who does this herbal concoction, and she drank it and immediately she got pregnant. And you know, for somebody in that space, when you hear something like that, where, please take me there. And she gave me the lady's address, because at the time she was even pregnant with her second baby, so I was, this thing has got to work. If somebody who had a delay before, now pregnant with number two, please give me her number, give me her details. When she gave me the description of the place, it was some market in Mushin. Believe you me, when I say that, I've driven past that place and I don't think I can, that market is still there. I don't know if it's me being superstitious, but it's almost like the place has disappeared. Some very, very little tiny markets in one nook of Mushin. And I walked in there, and as I was walking down the market's corridor, whatever, I felt like I was in a scene from Tales by Moonlight. Calabashes everywhere. It was the most spooky thing ever. So the lady, she asked me a few questions. I told her about the diagnosis I had about, okay, one of my tubes is not really as patent as the other, but every other thing was fine. And she made me pay for this whole, probably about 15 bottles of medicine for myself and for my husband. And I brought them home. And it was the next morning, I went to take a sip. I'm not sure if it was the bitter taste of it all. I asked myself, what are you doing? What are you drinking? What is this? And in my kitchen, I just basically emptied everything down the drain. I never, because it just didn't feel right in my spirit. I didn't connect with it. I don't know why. Maybe it was fine, but I didn't feel right about doing that. And that was when I decided to go back to my old doctor. So I went back to see him. It was like a homecoming, because anyone who knows me knows how I feel about my doctor. So my husband and I now began the process. I was able to convince my husband that, okay, we'd been married about a year and a few months. So I was able to convince him, just for my sake, let's just start this process. So he followed me, we had the examination, he was fine, and my doctor did confirm that yes, my ovaries were polycystic, but I didn't have the syndrome. My periods were pretty regular, so he felt that I didn't need anything too invasive. He also was able to deduce that one of my tubes was completely blocked, and I had a few adhesions from fibroid surgery I'd had 2 years before. But during laparoscopic surgery, the adhesions were cleared. So I was pretty confident. Yeah, one tube was blocked, but the other one was patent. And yeah, I was confident that, with the right kind of treatment, we would, get pregnant. Then I was prescribed Clomid and injectables as well. We did that for the first cycle. I was so convinced that, in fact, this is it. This is the first time we're doing anything, invasive, So when my period came, I was rude slap in the face, because that was the first time I was trying something different. And then, you know, it failed. Tried the second Clomid cycle, tried the third, they all failed. And each time, because I was being monitored, each time I had, you know, some nice follicles that were about to pop. One or two, the first 2 times I was given the trigger shots for it to induce the ovulation. So when it happened the first 3 times, nothing happened. My doctor wanted me to go on a break. He wanted me to just rest. He said, look, you've been married for less than 2 years, just rest now. He thought I was too young. I didn't think I was that young. I was approaching 33. I didn't think I was that young. So I was a bit irritated. I was impatient. I thought he was not moving fast enough for me. So I went on holiday, came back, and I said, you know what, it was while I was on holiday, I decided I'm going to take this to the next step. I'm going to try IVF.
I met my husband on a plane. Coming back from Ghana, he was sitting beside me. And we had a delay of about 2 hours while we were in the plane. And we spent the 2 hours talking, and we spoke throughout. And I think God deliberately delayed the flight. They said we were about to take off, and they said something was wrong with the plane. And so we spent 2 hours on the plane talking. To be honest, I didn't think of anything, but I think he did. And he was already plotting. I know he would kill me for this, but hey, he was already plotting how he was going to ask me out, even though we were on the plane. And so when we got down, I just gave him my number and I walked off. A week later, I got a call that, would you like to go out for dinner or lunch? And let's just say that's how it started. We started trying January 2013, officially. And it's been a long ride, you know, because, hey, I have had a child before from a prior relationship. So I just figured it was just going to be like that. And so initially, all I did was, vitamins and all. And then he started stretching and stretching and stretching. And I was like, okay, it looks like there's something wrong. And I was like, no, there's nothing wrong. You guys will be okay. There's nothing wrong. And then by the time it was a year, I started self-medicating on a lot of stuff. It still didn't work. So like almost a year and a half later, we decided to, okay, let's just go get tested and see what's going on. That was 2014. So we went and got tested and said, we're fine. I said, thank God. We're fine, your husband is fine, both of you are fine. I'm like, okay. So to just keep on trying, or do you want to try treatments and all? At that time, I was like, look, let's just keep our monitor. They said there's nothing wrong, so let's just rock. But another year went by, and by this time, my husband was like, you know what, let's just get treated. Let's just get something done. But, you know, you can't treat what they made, there's nothing. So we decided, okay, let's just do IVF. That was May 2015.
My husband and I got married in 2009, and like every young bride, you just assume that in 9 months' time, everybody would come back, or at most 10 months, would come back and, you know, would have the ikomo, as we say in Yoruba. And, you know, it was just an assumption in my innocence. And I remember then I worked in the bank, and my husband worked in a telecoms firm, and, you know, everything was fine. We're okay and ready to start a family. And because of the fact that we both married late, we were both in our 30s when we got married, so we were not going to wait. We were planning to start almost immediately. So I remember on our honeymoon, we would tease each other that we'll probably have a honeymoon baby. The honeymoon came and went. The first month went, the second month went, the third month went, and still nothing. And that was when I started getting nervous. I remember going to one of the hospitals on the island to have my first scan ever. And prior to that, I'd never had anything that invasive. So the doctor gave me the first shocker, told me that I had fibroids, and in the world of fibroids, that he measured a 3-month-old baby, and I didn't even understand what he was talking about. So I went home, told my husband. The doctor said I have fibroid. Maybe that's what is delaying us, and maybe I need to do, an operation. So I went to another doctor for a second opinion. The doctor said we were both young. We shouldn't be too anxious, have fun whilst we wait. So we went on again for another 3 months. Nothing happened. So I remember really getting nervous, and my dad getting nervous as well, and my mom at this point at 6 months, nothing had happened. And so I went on to another hospital, did another test, the same thing. There's nothing wrong. We can't see anything wrong with the both of you. Yes, you do have fibroid, but it's not that major that it would stop or delay anything. So we went on, living our lives, but at the back of my mind, it was still something that stole my joy. And it's funny, when I see women that are waiting, you kind of recognize it in their eyes, because it's like a missing light. The person may not know, but because you've been waiting and you've been through that journey, it's something you can pick up. It's just something missing, some joy missing. So we went on. 1 year went past and still nothing, and that was when I started panicking. So I went back to the doctors and went back again on the fibroid situation, that could it be what was causing the delay, and they still were, no, we don't think so, but if you want us to begin to investigate, we can start to investigate. So the first test they asked me to do was an HSG. That's the test that checks your tubes to see whether everything is open. So lucky for me, work sent me to South Africa, so I just decided to get that done whilst I was out there, and brought the results back. And when the doctor looked at the results, what she said to me was everything was functioning, but one side was not so I can't remember the word she used, probably wasn't working properly, but that what I had was still enough, and that if I wanted to still go ahead with the surgery, and if that was what I wanted to do. And I thought to myself, yes, spoke to my parents, spoke to my husband, he was fine with it. I had the surgery done in 2011. This was 2 years later. And I can remember the doctor telling me that now that the fibroid was out, in a matter of 6 months after healing, that I would come back to them with good news. That didn't happen. A year passed, nothing happened. So at this point, I was really frantic, constantly crying. My husband, fantastic man, he wasn't moved. I think we both survived on his faith in those days, because at this point I kept on asking myself, oh God, why me? This is almost 3 years. I started feeling ashamed. I was just, all sorts of emotional. But during the day, I didn't let it get to me. So I would just wash my face, get up and go, laugh. My friends that had babies, rejoice with them. I would go to parties. But I would still come home, cry, shut my doors, cry, ask my husband, why me, pray, cry some more. 4 years passed, nothing. The 5th year came again, nothing. I'd gone to another hospital, and I tried the doctors called it like an assisted bedroom, IUI. And that was when I met this family friend, a couple, Bumi. Fantastic friend, she just took me on a journey as well. And what she said was she had a doctor on the island that she could introduce me to, and that the doctor was fantastic. I wouldn't mention the hospital, somewhere in Lekki.
I think the only thing that a couple can do is to embrace a healthy lifestyle. In terms of, if you are overweight, you lose weight. Exercise is good. Watch what you eat. A healthy, balanced diet, and avoid alcohol and tobacco. Alcohol in moderation, tobacco not at all, and of course social drugs to be totally avoided. And then for a woman, once she has decided that she wants to begin the route to conception, she should start taking folic acid. Folic acid 3 months before conception has been shown to reduce the chances of certain kinds of miscarriages.
I got married in 2011, in April 2011 to be precise. And then, as with many women, you know, the expectation was when you get married, just a few months along the line, you're expected to, you know, become pregnant and begin to start a family. And that was the plan, you know, from get-go. But a year after I got married, you know, we no sign of conception, no children, no pregnancy. I wasn't really alarmed a year after because I felt we still had some time, you know, we're young. But I was advised by, you know, family, some friends to really just go for a routine checkup and see if there's any problem. So I contacted a gynecologist in Abuja where I stay, and he advised me to run some hormonal tests to just get a sense of what was really going on and if anything was wrong. And then we ran some tests. I first of all, I saw the gynecologist and I ran some tests, and the test results came out and the doctor said I had PCOS. And I was, what's PCOS? I've never heard of PCOS before. I was wondering, what is PCOS? You know, and then he explained to me about that it was a hormonal abnormality and it could make getting pregnant difficult. I was taken aback because, you know, I never expected this. No sign, you know, I had regular periods and all, no sign at all. And I was really taken aback. So, but my doctor advised me that it was not something to be alarmed at, that there were treatments for it and everything. So I was put on different treatments to balance my hormones, put on Clomid, and I was really expectant. I was, you know, this is one of those things and it would pass. But 1 year, 2 years, 3 years, and nothing. And then I began to get worried. So I went to see another doctor. This time I went with my husband, and we ran tests together, and, you know, still the same diagnosis. So a friend of mine, no, my cousin then told me, as at the 4th year of marriage, that would I want to, you know, try IVF, assisted IVF first of all, or IUI. And I did my research, but I wasn't quite ready then. For some reason, I wasn't really there yet to contemplate IVF. Now, when all that was happening, I started having these really painful cramps. And then, so I went back to my gynae and did some tests, and my gynecologist told me that I had fibroids. That also took me back. I was like, what? I'm dealing with PCOS, I'm dealing with infertility, and now I have problems with fibroid. This was just too much for me, you know. So I asked him, so what do we do now? He looked at the size, did some tests, and said I would need to remove, you know, to do an operation to get rid of the fibroids. And after that encounter with that doctor, I actually just ran away, and I said, no more doctors. I don't want to hear anything again. This is just too much. And I don't want to say I was in denial, but I just put that information in a box, studied away. I wasn't just prepared, you know. I just said, let me just continue living with these cramps, taking painkillers, you know. But I wasn't just ready at all.
For my fertility journey, I think I have to actually go back to how I was growing up. I was the kind that fantasized, like I fantasized about getting married, having children, like I think that's really all I wanted. Everything else was just like by the side, but I wanted a family and I was actively seeking that. So when everybody was out, you know, chasing everything that is anything, I was busy looking for that one person that I could settle down with, even from a young age. Like I was so early. It was so early when I started looking out for you know, that man that would complete me. And I found him when I think I was 20. I was 20 and he was 22. We were on the same page in terms of what we wanted. I was actually a goody two-shoes, so I hadn't really done much. Like I really knew what I wanted, so I saved myself in every way you can think of, you know, to be able to be that person, that homemaker, make sure that I have no problems conceiving. I actually thought it was kind of like in my hands, like if you act or you are in a certain way, then things will happen the right way. So that's more or less how I was. I remember my husband and I even arguing about how many children we wanted. I said I wanted 4 children. He was like he wanted 5 children, and we had such a huge argument about it. Like it was, you know, looking at it now, I'm like, wow, really? But those were the kind of things that I was thinking of then, you know, big family and all of that. And I think I actually started my journey really early in marriage. I was 25 when I got married, and I thought everything worked out in a certain way. Like you get married, next second, like I started trying immediately, like I didn't waste any time. And when I found out that I would have a fertility journey, in quotes, I think that was one of the most painful things to hear, that I had to go through IVF to be able to have children.
My journey, my foray into the fertility started pretty much with my aunties. I had 2 aunties that were trying to conceive, that I've been trying to conceive all my life. I've known them all my life and they've been trying to have babies. And then one of them proceeded in her journey. She had fibrosis. She was diagnosed with fibrosis and she had to undergo multiple surgeries. The final of which was the removal of her womb. What's it pronounced again? Hysterectomy. She had to have a womb taken off because the growth kept coming back, and each time it was painful. Each time was painful than the last. It was painful to watch.
Is that I will dwell in you.
It's always good to be knowledgeable, first of all, to know what the physiology of reproduction is, at least to have an idea of how it works, and to know the timing. You know, it is timed. A woman ovulates at a particular time in the month. Some people, you'll be surprised, don't have a clue about such things. Nowadays, there are things you can use to check ovulation kits and then time it and have intercourse. And then if you know you are not ovulating, then you can seek help, and there are ways of helping. But again, I would say at this point that some people now tend to abuse some medications. They go on their own to buy drugs that would make them ovulate. Some things could be dangerous, and it's always better to seek seek medical help rather than try to help yourself.
Infertility has been, would I say, pretty close to me. Reason being, my closest friend, my best friend, faced it. So early on, even before I knew that, I mean, I wasn't married yet, so I didn't have the experience of waiting, but I experienced it even before my time because my closest friend went through that. And it was a very trying time, I would say. If it was a trying time for me as a friend, I can't even imagine how much it was for her. There were a lot of expectations when, at the point of marriage. a lot of things we took for granted. I mean, you just assume, it's almost like when you go to school, you assume that, oh, I get married today, I'm going to be pregnant tomorrow. I mean, you go as far as even deciding that you know what sex the child is going to be. And those assumptions that, so a month came, 2 months came, 3 months came, so some reality starts to set in that, oh, life is not a bed of roses, so to speak, you know. And then she started going through different things. The feeling of being down, would I say, support or the lack of it from other family members, even people that we thought should be understanding. And so I think what I've gone through with fertility is, so I learned a lot about it in terms of the fact that, so you don't just take it for assumption. What she went through, there were different hospitals in terms of consultancy, trying to find out, okay, so what is happening, who, where, what, things that as friends we never talked about before because it's just issues that didn't come up. It was taken as an assumption. She went through a lot in terms of feelings. I think for me as a friend, it was difficult knowing how to support at first, because I mean, I can say this now, but at the time it was even difficult to talk about other people having children, because I didn't know at what point would it be too sensitive for her to handle? Would it be, I mean, you know, when you talk about, oh, so and so person is pregnant and you're not sure if she's going to go home and cry, you know, all those little things. I tried to support. I can't tell you that it is easy. It's not the same level as somebody passing away, but it's very tough because you're trying to give hope when you're not sure where the hope is, is going to, in the sense that it's not something you say, oh, it's going to end tomorrow, because we were not sure. But I kept trying to encourage. We kept praying together. And even as I was praying, I was scared as well, because I was thinking, okay, so you pray, and at the end of month 1, there's a bit of disappointment. You pray at the end of the next month, there's more disappointment. We keep praying and encouraging. And I mean, 3 months passed, 4 months passed, 5 months passed, a year passed. And for me, I had to stay positive, because if I didn't stay positive, how was I going to support? And in being positive, it's very difficult when you're not sure where the end of the road is going to be. Then I think for me, that was my first experience with infertility. And I mean, I've had a couple of other friends and colleagues that have experienced the same delays. And the experience I took from that was to just keep encouraging, but also to try and be real. Because along the way, I also realized that sometimes trying to pretend that nobody else has a child around is almost as bad as, what's the right word? It's like it's more glaring to the person when somebody has a baby and you choose not to react to the child because you don't want to upset the next person. It's actually worse than actually just taking it and being natural.
It's been quite close, pretty close. I've had family members and I've had friends and colleagues. So it's nothing really strange to me. And well, with everybody, every case sometimes is quite unique. The way they handle is different. Different people handle theirs differently. And well, all we can do is, support and encourage them through the trying times.
Before now, infertility has been close to me for most of my life actually, but I never really paid attention to it until the fertile chick came into my life. That was in 2015, and it just sort of opened my mind, my eyes, to see some of the things that I'd been seeing and not just paying attention to for almost all of my life. More recently, I've had to work with it with one of my own sisters, my blood sisters, and it's not exactly how do I put it, a pleasant journey. When you know so many things and you're imagining so many scenarios in your head about the things that could be done and the things that you cannot do, and then there's the family pressures, and at the end of the day, today we have a beautiful testimony.
The first thing is that the world is changing. During our father's time, they used to have pregnancy, or used to get pregnant a lot earlier, in their early 20s. But things are changing because our focus is more about careers, developing yourself. So from that point only, the age at which we start trying to conceive now is gone up. So let's say mid-30s. And when you're in your mid-30s, you're not as fertile as you were in your 20s. So that has a contributory effect. Apart from that, now, people don't practice as much safe sex and things like that as they used to be. So in this part of the world, sexually transmitted diseases are quite common, and that can affect both the man and the woman. It can damage the tube, and it can reduce the quality of sperm. Also, what we are seeing more recently is that surgery has an impact as well, especially when people have termination of pregnancy. We notice that that has a major contributory effect in this part of the world as well, because unfortunately termination of pregnancy is illegal in Nigeria, but people still do it. So they go on trained personnel to do it. So when they do it, that can damage their womb, and then it leads to infertility, or even cause infection, and then leads to infertility issues in the future. So when people come to us, sometimes those are the things we see, and we have to try to correct that. In the male, it's more about healthy living. Sometimes, all over the world, people are getting more bigger and not as active. So when that happens, it's been shown to, and also as well, in this part of the world as well, there's a lot of alcohol drinking. So that usually, those are things that affect the quality of the sperm. So you can argue that 50%, unlike a few years ago where people used to think that it's only women that this affects, but in current times, the percentage is almost 50-50. So if you're investigating couples for fertility issues, you'll see that 50% of the time is the male that is responsible, rather than how people think that it's all women.
Starting the IVF process in actuality and not theoretically was a different thing. When I had to go through the tutorial for the injections, that was when the penny really dropped, that okay, this is what I'm about to sign up, this is what I'm signing up for.
We did the first IVF, and somewhere towards the end of it, I was given an injection that was supposed to help me release the eggs so that the eggs can then be collected, and I reacted badly to that injection.
The most traumatic part was the injection. I had the phobia for injections before my first cycle.
So for every single time I saw a needle, I just looked straight ahead of me.